group. Now the last group هو السنجل gene disorders with abnormal Mendelian inheritance. عندنا 3 examples راح نتناولهم. أول example هو fragile X syndrome اللي هو من حكينا بالبداية على ال trinucleotide repeat mutation. Fragile X syndrome is a genetic condition that causes a range of developmental problems, including learning disabilities, cognitive impairment. Usually, males are more severely affected by this disorder than females. Affected individuals usually have delayed development of speech and language by the age of 2. Most males with Fragile X syndrome have a mild to moderate intellectual disability, while about 1/3 of the affected females are intellectually disabled. Seizures occur in about 15% of males and 5% of females with Fragile X. Most males and about half of females with Fragile X have characteristic physical features that become more apparent with age. These features including long, narrow face, large ears, prominent jaw and forehead, usually flexible fingers, flat feet, and in males enlarged testicles or macroorchidism after puberty. إذن fragile X syndrome هو disease related to the X chromosome. احنا أخذنا حسب قانون مندل diseases related to the X chromosome فقط تظهر بأعراضها بالميلز. الفيميلز يكون carrier. الابنورماليتي here انه الفيميل also carrier لكن الsymptoms are mild. This is a typical picture of a patient with a fragile X syndrome. Here a mutation in the FMR1 gene that causes a fragile X syndrome. The FMR1 gene provides instruction for making called Fragile X mental retardation 1 protein or FMRP. This protein helps regulate neural function. Nearly all cases with Fragile X syndrome are caused by a mutation in which the DNA segment, known as CGG triplet repeat. This repeat will be expanded more than usual. That's why it's called trinucleotide repeat mutation اللي حكينا عنه بأول محاضرة. Normally هذا الريبيت موجود 5 إلى 40 مرة. لكن if in some people this repeat will be more than 200 times. Abnormally expanded CGG repeats will affect the expression of the FMR1 gene, which prevents the gene from producing FMRP. Loss or a shortage or a deficiency of this protein will disrupt the nervous system function, leads to signs and symptoms of Fragile X. Males and females with 50 to 200 repeat mutations of the CGG segment said to have a pre-mutation. بعد ال 200 راح يدخلون بمرحلة الفول mutation. That's why and this هاي العملية راح تكون dynamic throughout generations. لذلك تلقى with time with each generation the females will be affected more and more. And this example or under the microscope راح نلاحظ هاي المنطقة التيرمينال بالكروموسوم X شلون تكون fragile. Thank you.